thing about is Obamacare, he is going to let the old folks die. He tell you take a blue pill for pain and die. Yeah. That's it.
The president's going to let old folks die. Welcome back to the Ed Show. Sarah Palin wants you to think that. She wants you to think the government's going to kill her son. Newt Gingrich even backed her up on that statement. Chuck Grassley, he's off his rocker. He's out there on these town halls stoking the already raging firestorm of protesters shouting that the president of the United States is going to knock off old folks. They are all wildly distorting a provision in the House reform bill that has a provision in there that would give you coverage for voluntary consultations with a doctor and a healthcare professional about your wishes, your family wishes. For more, let me bring in the author of that section of the bill, H.R. 3200, Section 1233, Congressman Earl Blumenauer, with us tonight on the Ed Show. Congressman, let me ask you straight up, are the Republicans lying about this alleged death panel? I mean, they're saying that there's a death panel. You put it in there. You're the one. Are they lying?
They are lying.
Thank you. That's what I wanted to hear, because that's exactly what they're doing. Congressman, what is this provision that is causing this firestorm and striking fear in the hearts and minds of seniors across America?
It is a bipartisan effort to make sure that senior citizens and their family have an opportunity to get consultation with the medical professional of their choice, to know what they're getting into, to know what their options are, how to make sure the family wishes are respected. This came from bipartisan legislation that I introduced that no Republican spoke against, and in fact has Republican co-sponsors, and has had Republicans tell me and speak publicly about the need to make sure that seniors' wishes are respected and they get the tools and information they need.
Why? I mean, the polls are showing that this fear tactic is working. The president and his efforts to reform health care starting to slip with seniors. So how do you turn this around?
Well, it's exactly what you're doing here, Ed, is putting the spotlight on a blatant, obvious lie.
But you've got Senator Grassley out there basically endorsing this rhetoric. In fact, he mentioned your House bill on the stump, telling people that they should fear you, Congressman.
Well, and what's happening is that every independent observer who has fact-checked this gives this a for Pinocchio, pants-on-fire liar rating. Every major newspaper that's editorialized, people are seeing that this is a categorical untruth, that they are trying to spread falsehoods.
All right.
And I think, Ed, what's happening is that you're getting unprecedented attention, and something that is this blatant is not only exposing the lie about this provision, but it's showing lengths to which they will go to prevent health care reform.
Congressman, that is it. And I just find it, as a news consumer, hard to believe that someone of Chuck Grassley's stature in the Senate, who is the ranking Republican on the Senate Finance Committee, after all these years in the Senate, would just be making a mistake on a House bill, which he probably hasn't even read yet. And also stoking the fire on this, of course, is Sarah Palin. I want your response to this. Her latest posting on her Facebook: President Obama can try to gloss over the effects of government-authorized end-of-life consultations, but the views of one of his top health care advisors are clear enough. It's all just more evidence that the Democratic legislative proposals will lead to health care rationing, and more evidence that the top-down plans of government bureaucrats will never result in real health care reform. Well, I'd like to point out that there's rationing going on right now by the insurance industry. Dispel that myth right there about rationing, Congressman.
Well, the point is we are making choices now. Millions of Americans have health care rationed because they can't get access to it, or it's only through an emergency room. The point is there's nothing in this legislation that speaks to rationing. It's the opposite. It gives access to people. It removes the fear of bankruptcy that is stopping a number of people from taking advantage of health care opportunities. And it's part of what they're trying to do to change the subject. Making up things, keep layering argument after argument that's bogus, and hopefully they think something will stick. Well, I think it's catching up with them.
And finally, Congressman Blumenauer, we've seen some pretty contentious town hall meetings, and you guys are going to end up going back to Washington working on this. And I'm just curious, are you so hot under the collar about this after being so maligned by the conservatives? If you bumped into Charles Grassley in the hallway of the Congress, would you tell him to his face that you're not telling the truth to the American people?
Absolutely. I find this deeply offensive, and frankly, there are a number of friends of mine that I plan on following up with to try and understand what's in your head. This is stuff that you supported last month. Why aren't you speaking out in support of it now?
Congressman, great to have you on the program. Keep up the fight. You're welcome here anytime. I appreciate your honesty tonight. Thanks so much.
I appreciate your work.
You bet. Let me bring in our panel tonight. Democratic strategist Todd Webster, Wall Street Journal White House correspondent Jonathan Weissman, and also Republican strategist and former communications director for the Republican Congressional Committee, Karen Hanratty. Karen, are the Republicans lying out there, or are we just not hearing the right things? Is this all part of the strategy? What do you think?
Well, I have to agree with you tonight, Ed, that this rhetoric about the death panels is really overblown and it's not accurate. And I don't know if they're lying or if they just don't understand what's in the bill. And, you know, and I agree. They should have read all 1,000 pages of it as well. If they're opposing it, I want them to have read it. I don't think, look, I'm all for, you know, folks going and talking to a doctor, a clergy, an attorney, whoever, and making these decisions before they reach the point where their children and spouses have to make the decision, very difficult decisions. My parents have made those decisions. Yeah. My husband's made those decisions. I think it's very important. And, you know, I think I think the Obama administration really dropped the ball, though, on the messaging on this. And I think
I think they got to get tough. I don't think there's any doubt about that. Todd Webster, you've worked on the Hill for a long time. You were with Tom Daschle. There was always rumors about Tom. They were trying to vilify him for years. It finally got him out of office. When does we just had a congressman here say that Grassley's lying. When does the White House start talking like that? When does the White House take off the gloves and forget this bipartisan stuff? These people are playing for keeps.
Well, look, a lie will travel halfway around the world before the truth gets its sneakers laced up. And we're now seeing why they wanted to get health care done before the August break, because the longer that this sits out here, the longer the insurance companies and the HMOs have to try to organize these latching onto bogus issues and creating mini firestorms. You know, it's interesting that this is happening in August, because this death panel issue is like the lobster boy at the county fair. It's a sideshow from what the real issue in this health care debate is, which is health insurance reform, which is whether the status quo is going to be allowed to continue, whether insurance companies can continue to discriminate against people who have pre-existing conditions, whether 40 million Americans are going to have no health insurance whatsoever, and it's whether insurance premiums are going to keep going up 35% a year, and Americans are going to have less coverage.
Jonathan Weissman, I know a lot of media people go on vacation in August. I don't think anybody's leaving right now. I mean, this is as hot as it ever gets in August. Does this put more pressure on President Obama to become aggressive and answer some of these? Now, he did it the other day in Portsmouth, but he didn't go so far as to point fingers. What do you think?
Right. Well, look, I'm going to point out another thing that's against you, Ed, here. You know, Barack Obama really rallied this country during the election by talking in much loftier terms. He tried to kind of bring us toward our better angels and talk about what's good for the country. In fact, his approach in the last few weeks has been about you. What's in it for you? And he hasn't really appealed to the country to say, look, this is not about your health insurance. This is about what is best for our country, what is best for, 46 million people without insurance. What is right or moral about about reforming the healthcare system? Instead, he's had these little fights. These are little skirmishes instead of the big, broad battle that he should be waging.
Now, let me ask you, Jonathan, next week he's going to have a conference call with some religious leaders. What do you make of that? I mean, that is playing to the moral fiber of the country, is it not?
Right, and I think that maybe that's when he gets his footing. It's a very interesting battle with the evangelicals because, the evangelicals are pressing the idea that this is going to fund abortions, this is going to do euthanasia. They're playing small, the evangelicals who oppose this are playing small bore on it. Obama's going to try to play big and talk about morals, and we'll see who wins out.
All right, panel, stay with us. We've got so much more coming up. Appreciate your time tonight. Also,